Good morning, everyone. Today, I wanted to introduce myself. I'm Dr. Green. I'm here at Saline Women's Clinic. We're going to talk about what to expect during your prenatal care visit. So let's start the conversation off with trimester. So first trimester is between 0 and 12 weeks. Second trimester is between 13 and 28 weeks. And the third trimester is between 29 weeks and delivery. So at each visit, we offer something special, okay? Your first prenatal visit, we're gonna talk about your history. We'll wanna get to know you a lot better. So at this visit, this is the opportunity for you to let us know everything about you. This helps us know if you're in a low-risk pregnancy group or if you're in a high-risk pregnancy group, so we can offer you appropriate care. So we'll go through all of your medication lists, we'll go through all of your surgeries, all of your other obstetrical history, so we can get to know what's happening in your life and let you know what to expect for your pregnancy. We also obtain prenatal labs at this visit, and we perform an ultrasound so that we can determine your estimated date of delivery. So that's what's typically done at your first prenatal visit, around 8 to 10 weeks. So now we're here in your second trimester, again between about 13 and 28 weeks. A lot of important things happen during these visits. So we talk about genetic testing. This testing is very important to rule out Down syndrome, neural tube defect, and other genetic testing that we do offer here at Saline. We also do your anatomy scan around 20 to 22 weeks. This is one of the most exciting times because this is one time that you can determine the sex of your baby. Ultimately, that's not the goal of the ultrasound, but this is one of the events that happen as we do determine the sex of your baby at around 20 to 22 weeks. This brings us to our 24 to 28 week mark. At this time, we do your glucose test. This is one of the most fun tests ever. So most of the time, you know, there's a choice of the different flavors and things that you can have, but this helps us rule out diabetes. It's important for us to rule out diabetes so we can make sure your baby doesn't grow too big. So here at Saline, we do our glucose test a little bit different. We actually let you take the solution home around your 20-week visit. We ask that you store the solution in your refrigerator as it can help the taste of the glucose test. So basically, you'll drink your solution on your way to clinic, and when you check in, you let us know what time you drank your glucose. We did take you to lab at an hour mark, and we check your blood to see what your glucose levels are. At all of your visits, we take your blood pressure, we take your urine. We want to rule out infections. We want to make sure your blood pressures are normal. We also look at your weight so that we can make sure you're gaining weight appropriately. And again, this happens at every prenatal visit. This brings us to the third trimester, lucky 29 weeks. So at this time, we have more frequent visits. So they're about every 2 to 3 weeks depending on which provider you see. At these visits, we want to make sure that your baby's moving. We want to make sure that you're having maybe a few Braxton Hicks but no labor. We also, around 36 weeks, do a screening test for what's called Group B strep. Group B strep is a common bacteria that can be present in some women and not in others. So if it is present, we want to screen so we can treat you appropriately during your labor process. Around this trimester, we also discuss your delivery plans. Your delivery plans can be discussed at any visit, whether it's your first prenatal visit, whether it's your second trimester visit. Whenever you're excited and you want to discuss your delivery plans, we're open to hearing your thoughts. So typically we offer inductions around 39 weeks, but we also believe in natural labor. So whatever you decide with your provider, we want to make sure you make an informed decision. So around 36, 37 weeks, again, that's the time we do your Group B strep testing. We also offer cervical exams if you're exhibiting signs of labor. Again, this is physician preference. Some offer it exactly at 37 weeks. Some offer it whenever you desire to have that exam performed after 38 weeks. So just to let you know, we do offer, but it is not mandatory. If you desire not to have your cervix examined, that is your choice, okay? So again, we are accepting patients. We have a new OB clinic with 4 providers. We also have 2 nurse practitioners that also participate some in our obstetrical care. And labor and delivery unit is just across the hall. We can't wait to see you.